I know I have to clean up my garden in the next couple weeks if the garden closes, but I'm like, but it's still growing.
Exactly. My cucumbers are just starting to grow. They did not grow all summer long and now they want to grow.
I have to divide some. Yeah, check your microphones to see if they're on.
I did.
Okay. Is yours, Alex? Okay. And we all do it. Even though we've been yelled at several times. Let's give it a minute. Yeah,
Household.
I don't know. I know he's not going to be here tonight. He's excused, but I don't. Yes, I saw him at executive committee a week ago. He seemed fine.
I worry
He was-
about his wife.
I do too.
Yeah.
Yeah, I really worry about Cheryl. The only thing he said to me was that she's not doing real well. So I don't know what that means.
His comment to me was that enough that he needed to stay home and he didn't want to do that and he felt selfish.
All right, let's go. Good evening, everybody, and welcome to the Dunn County Health and Human Services Board for Thursday, September 25th. I'll call this meeting to order. I let the record show that Supervisor Hagan, Supervisor Morehouse are present. Supervisor Breslin and Supervisor Steen are excused. Dr. Hall, Ms. Rudy, and Mr. Lamb are present. Yes, Supervisor Bashan, I missed that. Sorry. Can't even read my own handwriting. Sorry. All right, we have meeting minutes for our last meeting of August 21st. Has everybody had a chance to look at the minutes? Anything that anybody needs clarified? Or I'm going to suggest that on the second page of the minutes, Gary Stein is spelled incorrectly. It should be Steen. I'm becoming one of our colleagues who always points out typos in the minutes. All right. I could use a motion to approve the minutes for August 21st. Dr. Hall, Mr. Lamb, second. Any additional corrections, additions? Dr. Hall was the first and Mr. Lamb was the second. All right. We ready to call the question? All in favor, say aye. Aye. Any opposed? Minutes for August 21st are approved. I don't believe that we have any public comment. And we need to talk about, I'm sorry. No. Thank you. We have to talk actually about a couple of meeting dates. The next meeting of that is on, I think for sure, unless it's a problem for anyone, is next month, October 23rd. Our subsequent two meetings are scheduled for Thanksgiving and Christmas. We get stuck in that every time. So I have suggested that we cancel the November meeting. And we can wait for the December meeting until we see what pressing things are on the agenda or not. We can cancel if they are not. Paula?
We did already reschedule for the 18th, so it's on your calendars, but we will cancel if.
Yeah, and obviously we weren't going to meet on Christmas Day. So there you go. All right, any problems with that? All right, moving on. If there is no objection, could I move Tracy Fisher's presentation up at this point so she can go home and spend some time with her family? There you are. Thank you, Tracy. Thank you for being here.
Thank you. I appreciate it. Thank you, everyone, for having me tonight. I'm excited to have the opportunity to provide some information on the Aging and Disability Resource Center, or the ADRC, here in Dunn County. So I'm just going to highlight 3 points. I'm kind of referring to this document. If folks, I believe, received that in their packet.
Yes.
I'm just going to talk about services we provide, the financial value we bring to Dunn County, and how we operate with one of the leanest staffing models in Wisconsin. So
Really.
first, I just very briefly wanted to go over some of the services that we provide in the ADRC. We connect residents to some pretty critical resources, including information and assistance, options counseling, and access to long-term care programming like family care and IRIS services. We provide disability and elder benefits assistance. Senior nutrition and Meals on Wheels are provided through our office, as well as caregiver support, health promotion programming, and transportation services for our adults with disabilities and elders in Dunn County. So our services prevent crises, help to reduce isolation, and help people stay independent in Dunn County. Those are our real goals. So financially, overall, if you look at the full picture, the ADRC saves money, saves Dunn County money. I just want to explain that. So if you
Yeah.
look, our net expenses are about 2.4 million. And then of that, about 1.8 million of that is covered by our grant revenue. So that leaves a little bit over $614,000 that's covered by county levy. However, with that, you have to consider a couple of things. One, in Wisconsin, every county is responsible for paying for what is called the family care program. We have to contribute annually to the family care program. This is a state mandated service that has to be provided in every county, is statutorily required to contribute. In Dunn County, the amount that we contribute annually is that $398,401. That is directly billed in Dunn County to the ADRC budget. Okay. Then last year in 2024, in total, the ADRC contributed $401,663 to Dunn County's AMSO and indirect costs. Because of the way systems work, we are able to bill some of those costs to some of the grants that we receive in Dunn County. So if you add up those two amounts, that family care cost, the family care program cost of about 400,000, and then the shared cost, the AMSO and indirect, of about 400,000, that equals a little bit over 800,000. And as you know, the levy amount is only about 614,000. So net, Dunn County saves a little over $185,000 through costs that are absorbed by ADRC. If ADRC for some reason ceased to exist, Dunn County would still be responsible for these costs, so would have to carry them in full. So I don't think people always get that full picture of how all these numbers play out. And so I think it's Paula and I created this graphic, and I think hopefully it spells it out fairly simply. So I think that's good news. And then moving on to the next, our staffing graphic. One piece of feedback I think that we've received in human services is that it's interesting for board members to understand how we compare to similar counties. And so I looked at some numbers. I reached out to ADRCs that are in our general area. And then I also took a couple that I just wanted to compare because they have very similar populations. So that's Monroe and Wapaka counties. And, just compared apples to apples, how we're staffing programs. So as you can see, here in Dunn County, our population is about 46,000, and we are serving that population in the ADRC with a staff of about 12.5 staff members, which is significantly lower than
Mhm.
some of the other staffing models that you can see. I think
Lower
that
than Clark County.
lower than Clark County, which is significantly
Yeah.
smaller and, 15,000, more than 15,000 less in population. So, I would say that our office, we are really proud of being efficient and providing what I consider to be a really high level of quality service to our consumers in a very responsible and lean manner. I will say, I think this indicates that my staff are probably serving more consumers than their counterparts in other counties. And I appreciate them very much for that. And I think that they should be recognized for the service that they're providing for Dunn County. And we just really appreciate your continued support and hope to be able to continue this level of service for the county. So, but I was very proud. I will have to say, I asking these numbers for my counterparts across the state, I agreed to provide the data that I collected so that everyone could use it and share it. And it was very eye-opening for a lot of folks. So it was interesting.
bet.
And another thing I did just want to point out that I didn't highlight, but a member of our ADRC committee who is a former board member and historically is very familiar with the ADRC said that he found it very interesting. In the past, there have been discussions about doing combined county services and if that would add to efficiencies within counties. And he's like, your data is kind of showing that that is not in fact the case.
Sure.
Because if you look at some of the combined models, their staffing numbers are actually considerably higher per population capita than ours. So he found that very interesting, and so did I. That's not probably what I would have expected to see either.
Yeah.
So does anyone have any questions for me?
Any questions for Tracy on these data? Yes, Supervisor Bashan.
One thing Tracy did not say, of those 12.51, one is brand new with the LEQ grant.
Yes.
So it really is 11.51, not counting that.
Thank you, Supervisor Bashan. That is true. So the LEQ grant is a fully grant funded position. That is not a permanent position. It will end in 2027. So of our base ADRC employees, we are actually at 11.51. No other county in the state has an LEQ position that is unique to us. So if you were truly comparing apples to apples, we're actually at 11.51. So even lower than what is reported here.
Are other counties doing LEQ?
Well, our LAQ program serves the entire state, Diane. So we are reaching out. We're
Somehow
global.
or other, I missed that.
Yes. So,
Okay.
that's part of the program. Mary, our case manager for LAQ, is reaching out. We have kind of a staged implementation of growth. Our focus right now is still on rural counties. So we're doing that. But the goal will be to do outreach to every county in the state. Some of that has happened in some ways because I presented the program statewide to all the ADRC directors. So some of that has already happened, but in terms of real direct contact with staff at the local levels, we're doing that kind of in a staggered way.
Other questions for Tracy?
Can I add
Paula,
something?
yes, please.
Not every county looks alike either. So an example, Eau Claire, they have a separate department of ADRC. And so, like Tracy said, the Amazon indirect helps pay for part of my position
Sure.
in the support staff and those things. So that is a cost saving by not having it a separate department and underneath the umbrella. So just wanted you to be aware of that it
Yeah.
could look different. There's multiple counties that have it as a separate agency or separate department. So I think, when you combine them together, that's a real cost savings.
Yeah, absolutely. Yeah. Anything else? Thank you, Tracy.
Thank you so much.
Thanks for the nice graphic. Very
Yes,
helpful.
I appreciate that your time, folks, and thanks for all the work that you do.
Thank you.
Thank you.
Thank you. Exactly. All right. We are on to item 6 and a couple of items that were added. I unfortunately failed to add the food share resolution as an action item. So we'll just discuss it today and get some of your suggestions if you'd like to see it changed. Anything else, and we'll bring it back to you in October. Does everybody understand the context here? So the federal government has cut SNAP benefits and have added work and other requirements. And because that is probably going to increase the workload and with sort of hard to verify things or time consuming things to verify like employment, it's entirely possible that our already small error rate will increase. And if that happens, we will be subject to penalties, fairly significant penalties. Dr. Hall, did you have a question? Okay, okay, all right. This originated at the Wisconsin Counties Association. And they are really interested in saving the state, which is likely to be considerable amount of money. So we brought this to you for your observations and your wishes about it, and we can come back to it if you wish in October. Paula, do you have anything else to add?
I do want to add, that as you would expect, we have a lot of concerns with our budget and this. We do have a vacant position. We had somebody resign, and we worked with Dan to make the decision that we would hold up on filling that position because we don't know what this impact is going to be. Now, of course, like what Diane said, it may impact our numbers.
Oh, yeah.
And performance and those types of things. We also have a contract with Great Rivers to provide that staff. So hopefully just hitting the pause button for a while, like they'll accept that and we can have more conversations with that. But I wanted you to know that we're, looking at this and want to make sure that we are, trying to prepare ourselves as best as possible.
Okay, so you discussed a time frame on the staffing?
Yep, the next training, because we didn't post now, the next training that the state has is January. So we said, let's take a look at it beginning of November and see
Okay.
where it's at. And then make a decision at that time to see if we would go back to filling it or not. And the state is, they're looking at, do we backfill, not backfill? There's some
Right.
conversation of it, but there's nothing set yet. So if the state sets it by that time and says, yes, we will backfill, then we would be able to move forward.
Right.
But we're just being super cautious right now.
Yeah, and I think that makes some sense. Questions, comments? Yes, Dr. Hall.
So I appreciate the document. I think it lays things out really well. The only thing that, if I were the editor, on the third to the last item on the first page, the whereas, so it talks about county administrative costs. And it's $123 million annually. Is that for the statewide? Right. So I just think that should be specified. Because this is for the state, but I was also curious to know what those administrative costs are for us as Dunn County. Because what are we looking at in terms of the loss going from that 50% to 25%? Because then I think, big numbers, people aren't good at feeling what big
Right.
numbers actually are. But if we can say, that's what it is statewide and in our county, this is what we would be looking at, that might be helpful.
I think I agree with Dr. Hall. It would be nice to have some local information if it's possible to pull it. For Dan.
I think that's what the title was, and that thought so far.
Yes, Dr. Hall, please.
I'm not super familiar with how the language of these things should go, but as we look at the last page, in terms of let it, be resolved that we urge the state of Wisconsin to provide funding to offset the county fiscal impact caused by these changes. I don't know if you need to specify the full fiscal impact. like I don't know. I mean, to offset it, like, oh, we'll give you, here's $1,000 to help offset. Like, I don't know if we need to specify what we mean by that. So that's just an open question that I have.
Yeah, it is. Generally speaking, we don't tell them the full amount and this is probably going to be shared with the Wisconsin Counties Association, which will carry this forward. And I suspect they have their own numbers to add. I don't know if they talked about this week.
Not in a session that I was just gonna go look at the full meeting and see what they.
Yeah.
That email that Dan is referencing talked more about the MOE and our contribution versus what that direct cost was going to be. So it doesn't give that piece of it. So
Okay.
I'll research and
Yeah,
at
reach
least I
out.
can share that with you next time and you can decide if you want to put in or not. Does that work?
Let's put it in
I'll
and
put it
we
in.
can review it in October.
Okay.
Yes, I'm sorry, Mr. Lamb.
No, so, tell me if this is correct. As I see this is attempting to address two issues that are obviously interrelated, correct?
Mhm.
All right, obvious, and just, but just, I always like to say it
No,
all.
go ahead.
So it really sinks in with me.
Just go ahead.
So we're addressing possible flow down costs due to a likelihood of the air rate statewide exceeding 6%.
Right,
So that's a possibility.
right?
Yep, okay. And
A
then-
real possibility.
Correct, yep, agreed. And then the second is just, we're gonna be losing federal funding on to assist with administrative costs. Okay,
Correct.
I just want to be sure.
Yes, Dr. Hall.
Wouldn't there also be, there's kind of a third ask in there saying that with the increased work requirements, that the actual administrative burden is higher. So I almost feel like there's also a little bit of an ask to not only meet the 25% that the federal government is no longer providing, but to bring it up a little bit because now the actual work associated with administering this program is going to increase.
Yeah, and there's a fair amount of evidence in Georgia and other places about how much it has increased staff workload. Mr. Lamb.
Well, just related to Georgia, I just happened to read this afternoon coincidentally. But when they imposed their work in statewide, they spent more on administrative costs than they would have saved. Yeah.
Yeah, I've read that. Okay, anything else that you'd like us to add? And I assume we are in favor of this going forward with some modifications? Okay, all right, there we are. The other thing that I added, and it is very open-ended and I just want your input, your ideas here, because I don't have a clue how to proceed. So last month, if you recall, we looked not only at proposed budgets for 2026, but we reviewed a set of priority items that each of the departments was requested to provide as input to the budget process, and particularly a budget workshop that we had. I'm not sure the process was great, but I think the identification of priorities that the staff has done is something that we should not allow to just pass on and sit on a shelf. That we ought to be regularly taking a look at those priorities. And if remember my numbers correctly, the health department had 16 priority programs listed. And again, if you remember those spreadsheets, it listed cost and staffing, mandates, some of the quirks of county level funding. The Human Services Department had 35. So it's a lot if you look at Greg did you do the priorities? I don't think so. Did we review yours?
No.
No, we didn't.
They weren't. They didn't make the list for the.
Okay. Well, everything you do is a priority. If you want us to add some levels of importance to your work, we can certainly do that. But I think I'm kind of excluding you here because unless you want us to talk about this.
I'm sorry. Yeah, there, certainly, I always have ideas on how to request and look for additional support and assistance for the work and stuff that we do, but I also understand the direction and guidance that we received for our 2026 budget. And
Yeah.
so my
Yeah.
first responsibility is to follow that guidance. And if there's anything that I'm looking for outside of that guidance, then I certainly would bring that forward. But I do believe that going into 2026, I'm going to be able to meet those priorities given the first go around with the budget. So
Okay.
does that answer your question?
Kind of.
Yeah, of course, I have a golden wish list, but the budget's already been submitted and following the guidance.
Well, and bringing this forward is more for 27
Mhm.
than for 26. And it would allow us to inform ourselves about those programs in ways that I don't necessarily think we are. I know that one of Paula's goals for the coming year is to educate the board. As human services programs in human services, programs in public health are just not well known. So the objective here would be to educate ourselves and to see if we have any kinds of creative ideas about either ways to educate others or ways to provide support or ways to fund that we can consider in the next year. So my idea that I proposed really inarticulately to Katie and Paula and required translation was that we take the next year to look at those priorities and see if we can use our collective wisdom. Obviously they are in charge of this, but to use our collective wisdom to provide some advice, some policy kind of context, some help. So I guess the first question is, are you interested with me in moving forward with this? Yeah?
Yeah.
Yeah? Okay. It's a lot of programs to look at. And we have 12 meetings, and I don't want to extend all of our meetings by an hour or two. That's not feasible. So I'm looking for ideas about how to do this in a way that doesn't necessarily increase the amount of time that we spend together in meetings. So I'm looking for creativity here, Dr. Hall.
So totally off the top of my head.
Please.
One of the things that I think about is I really liked those spreadsheets or what have you. I mean, there was some redundancy. There was some things that could have been polished and cleaned up,
Yeah.
of course, but thinking about also, do we use that as a template for annual reports, right? Do we look at kind of maybe trying to, or at least have some kind of acknowledgement if we identified this is a priority and this is what happened this year with that program, would be something to think about. The other thing that I wanted to point out is that I love that we have kind of special guest speakers who come to our meetings and tell us about their programs. And maybe and maybe you already have this, Paula. I don't really know what's happening behind the scenes, but just kind of a planned out. We're going to talk about the water lab this meeting, and we're going to talk about income maintenance next week, like kind of what we have been doing, but in a more formal and structured way, or at least a more obvious way to me. Perhaps that's, you already have a list that you've been working off of. I'm not sure. So that was my second idea. My third idea was, and I teach a public health class at Stout, and I'm like, it's always like, it's the stuff that you have no idea, right? It's the stuff that's behind the scenes. You only notice it when it isn't working. And so how do we, and I think the same is true for a lot of human services, right? People don't know it unless they've had need to
Exactly.
use those services. And so they do not understand what our county would be like without it, right? Because it just is invisible to such large segments of the county population. So just thinking about what avenues do we have for disseminating information to the public, like not even just the supervisors, but they're accountable to the citizens, right? So Dunn County's been doing some fun things with the Facebook page, right? So like, do we use social media? Do we use billboards, right? So like the sexual health reproductive clinic billboard for Dunn County, that was brilliant,
Yeah.
right? So finding ways to let people know. And I think it gets really tricky when it's like, we're providing, mental health support so people don't end up hospitalized, right? How do you spin that in a fun, billboard? There are some things that lend themselves a little bit more easily than others. But so thinking about how we communicate to the public all of these things that are happening behind the scenes that they're not even aware of, that are making all of our lives much better and the
Right.
quality of life in our community much better. So, but that was off the top of my head. So I don't have an answer to that, but how do
No,
we do kind
love
of
it.
public
The
education?
ideas off the top of your head. See this, you're such an asset to us. Polly, Miss Rudy.
I think I've learned a lot on this board about things that are just mandated. They're still coming out of our budget. And I guess I would like to see a breakdown of what are the costs for things that we have absolutely no control over whatsoever? And then what's left after that for those priority options? Because I think, I go home and even just talk to my husband about things and he is just shocked that, oh, we have to pay this no matter what. Yeah.
Yeah.
And I don't
Right.
think people realize that.
Mhm.
And when you look at the budget, that takes a lot of money off of it that we talk about just very quickly here. So I guess I'd like to see that breakdown a little bit.
Yeah, the programs that we are required to offer and would have to pay for, even if we don't offer them, is pretty significant. And you're right, both of you, that nobody understands that. Yeah, please, Paula.
So the infogram, that graphic that Tracy presented tonight and that we presented last month with economic
Jessica.
support.
Mhm.
To me, that's something like you could put on Facebook, Snapchat, or something that people from the community, like that's maybe the level that they,
Sure.
you know what I mean? The deep level would be too hard to explain at that level. What I'm wondering from you is if, like tonight, what if you want this plus looking at the ADRC budget specifically and the line items and how they, like more of a breakdown of each of those costs?
Or the
Or-
list of the ADRC priority programs. It's sort of program, I mean, that's what the exercise did, is look specifically at programs that deliver services to people in the county.
One of the struggles that I had with that is I think that it was done kind of in different pieces and I did some, Chris did some
Yeah,
for
I'm
human
sure.
services. And so it doesn't break down by each program. So some are in there, some are not. Like when you look at ADRC, it's kind of more of a chunk of things in some of them. So you're not going to get like the dementia care specialist and the programs that she does. So it's more of like a chunk in there, because otherwise we would have had like 500 lines instead of 32 or whatever, 35 or whatever
35.
it was, right? So, I mean, because there's so many programs and grants and those kinds of things, so they got clumped together. So, it's really hard to to use that document as a way to educate, because it's too combined. But I'm thinking if it would be helpful if you had a snapshot of each of the programs within ADRC and seen the funding that it costs for those programs and, you know, which ones, and then mandates or not mandates, so that you could take a look and go, is this a program we want to continue to provide or not? And what would be those implications?
Well, one way to do that would to be, you know, without doing a ton of extra work on that priority list, is to basically group them
Mhm.
by department as a
Or the program or
with
the
the
unit.
program at the program level,
Mhm.
and then include information about the specific line items,
Mhm.
if you will.
Yeah, I don't know if we need to go down to the, like, we spend this on cell phone and this much.
No,
on
no, 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 no.
But like this,
We look at that every
how
month.
much we spend at the program level
Yes.
for, and this is what we get for revenue for that. Kind of broader versus that whole really deep down.
Dr. Hull.
I mean, I would say ADRC as a chunk is great, right? Like it's great. And these are the programs that are within that, right? And this is how much money comes from grants. This is how much
Right.
money comes from, you know, and these are all the things. And then when we think about public education campaigns or things like that, we know that personal stories are really powerful, right? So, what did I see today? Somebody sharing that they graduated from maybe treatment court, maybe?
Yes.
Or something,
Yes.
right?
That's what we had in
Yes.
the packet.
Yeah,
Yeah.
right. So seeing the real impact of these programs and how they help our community by telling and sharing some of those individual stories, I think is way more powerful. I mean, I think here's how much money this program costs, here are all the services that are within it, and here's where that money comes from is great, but not at the detail level.
Yeah.
But then also finding ways to share stories so that people can actually understand what it is that's being done.
Yeah, I think that's a good idea. And finding ways around this table, I think, to understand and to ask questions of staff about, you know, are there other ways to do this? How do other organizations provide these services? Just to get sort of creative as we go into next year's budget, which is, you know, only eight months away. Yeah. 2 months away. I'm kidding. It's Supervisor Hagan.
Thank you. As we think about explaining things to the public or to the rest of the board on a like 100 or a 101 level for some of these services, I think we do a very good job at our presentations here in our committee. That's already being recorded and put up on YouTube. We can take snippets of those, even meetings that we've already had, take those out, put that in a special like Health and Human Services designation within YouTube and label it like per those sections. And there we don't necessarily have to go into much detail on the financing side of things with the presentations, but it will at least take what we already are creating and just kind of segment it out so people can find it a little bit more easy. And going off of the idea of personal stories, those would be great for YouTube shorts, Facebook shorts, TikTok videos or whatnot that are like less than, 10 seconds or whatever. That'd be a great opportunity to just get someone in front of a camera and say something.
Maybe we should probably have a sit down with Krista Vind, who does those wonderful, funny things, and see what we could do to edit or to add or. Yeah, Supervisor Hagan, go ahead.
So yeah, even Greg's stories would be great narrated because some of them are powerful. Yeah.
Yeah, absolutely. Any other ideas about moving on here? We'll try to figure it out. How's that? In a way that, doesn't take lots of extra time on our part. I mean, I don't want us to be sitting here till 8:30 every month, but if we can figure out a way to sort of organize the presentations, get it back to us and have enough opportunity to talk about, for example, the programs within ADRC. programs within economic support, programs within mental health. So does that make sense? KT?
My only concern is we would need to be really mindful about some of those personal stories. We would need to be HIPAA compliant, and we need to make sure that we don't target people that may already be stigmatized.
Absolutely. Yes, you're quite correct about that. So, Health Department, Human Services Department, this seems like an okay idea to pursue moving forward. All right, we'll figure out how to do it. How's that? Yes, Dr. Hall, thank you.
Can we maybe get a local celebrity in to get their flu shot?
You might. Dan, I don't know, has Dan had a flu shot yet?
We just crossed the HIPAA line.
Well, but he's a community celebrity.
We could say he's a celebrity.
Okay, let's go ahead then. Greg, it is up to you, Veteran Services, please.
All right, thank you. Good evening. I'll start report off with going over some of the activities locally for the Veteran Service Office. The first thing I'd like to identify and highlight is just the huge value of Project Hope, which in not my program, but it is absolutely a added value to the work that we do in the Veterans Office, and the flexibility and the direct warm handoffs that program does. And there's two individuals with the city of Menominee and one with Dunn County. And through the last month and a half, we've been working with a couple of homeless situations with some local veterans, and just that collaboration and accessing the variety of services. I think it helps things become more efficient and gets right to the point and the value of meeting those basic needs for those individuals, and then expanding out those near-term, long-term benefits that can help long-term stabilization as you look at the immediate housing need to then the long-term permanent housing need, along with the other basic needs, certainly with food, health, safety. And so that's been a very, very good collaboration, and even expanding outside of that, the local work is more, elaborate more in the impact statement, just to emphasize the coordination of multiple programs, from the district attorney's office to the jail staff to the Project Hope staff, and then with what our office is doing, everybody coordinating together to ensure that come up with a plan, and the adult protective services. So it's a huge highlight that I'd like to just put out there, that there's a lot of efficiency in those interactions, and can help a person get a little bit more stabilized and stuff. Ultimately, in the end, it's up to them with what they want to do with the personal choice on those decisions. So we're still working closely to help get situations stabilized for a couple local veterans, and want to identify and give some definite positive statements for the Project Hope staff. The other item on the state level, there's, as the president of our state association, there's certainly a number of duties they have to do, and there's annual report that as an association, that to identify as an association really the efforts that are being done to help all of the veterans within the state of Wisconsin, and to highlight volume. Everything is about numbers, just to ensure that we're doing our part as a collective. And within the state of Wisconsin, the Wisconsin Department of Veterans Affairs really has is a large player in that, when we're talking about getting support and assistance on that funding level. And they also deserve to hear what we're doing as an association, for them to be able to use that data to help support activities when it comes to governor's budget and things of that nature. Um, the other item I want to highlight is the Senate Bill
Mm.
411, and this was in response to some funding that was not approved within the governor's budget that ended up eliminating two of the veterans homeless shelters. And this is my opinion. I can't speak for everybody else, but my opinion is when we have a very high level of suicide percentage within the veterans community, and then we have a high level of homelessness within the veterans community, those items run parallel. And when you can stabilize a person that is struggling with purpose, struggling with feeling like they have a spot and a role for whatever reason, and then you take a little bit of that stability away from them, and that kind of puts them back in that fight or flight mode, and that can heighten those thoughts about making decisions that are permanent to deal with a temporary problem. And so we want to try to eliminate that. And I think that with this bill, we had part of a couple of the members of our legislative committee at the association, they testified to help support more specifically on that, to put some funding back in and request that for to find a new location for the Chippewa Falls Veterans Housing Recovery. That doesn't even get into the drain on the local resources, because everybody that's at this table, that impacts us, because there isn't one individual that doesn't touch every one of our programs in one way or another. And so that's an important thing. And I think that, and I know that we have some legislative items that we'll be able to put in there, and this would be one of those that I definitely would want to keep pushing forward. There's a couple other items in there. I don't want to minimize the importance of those within that bill, but for me, that's the highest priority, is to try to increase our number of homeless spots. We can see locally just the huge impact at having Karen House here in Dunn County, the impact that has on reducing the additional costs that it has for the drain on some of the other resources that can be put for other things. So this would just be an extension of that, and we can to help support our veterans community.
Has the association developed a resolution of support?
Haven't just testified. This is a new bill came out, and so we had our legislative committee go. We've got an executive committee coming, and there's a
That
couple.
might be something that could be drafted and brought back to this committee. I'm sure that we would be happy to look at it.
Okay. Thank you. Yeah. Okay. Yeah, I just think it's a win for everyone if we can maintain at least the levels of services that we have. And we had here, we do have individuals here in Dunn County, even though it's been centered over in Chippewa Falls, with plenty of veterans from our community that go over there, or veterans that transition back from other communities to come here. So the next item on the federal level, kind of the theme tonight is some proposed laws. This I want to just highlight a bill that is in the House right now, called Choice for Veterans Act of 2025. And the reason I'm putting that in there is just because of the potential impact on our veterans to lose money. I won't say lose money, but to invest money into services that are unnecessary, that are provided at no cost. And I would argue that are provided at a no cost at a high level. The proposed bill is to allow the continuance, because it is happening now. It's just that the law is not being enforced. It is illegal for anyone or any organization to charge money to assist a veteran with an initial claim or a follow-up, what's called a supplemental claim. Things change when you have to go to the Board of Veterans Appeals, and which it should. You need a higher level trained legal mind to be able to argue against and create a good a good rebuttal against the reasons for them to deny that. But at this level, so as an example, these organizations are charging 3 months forward of a veteran's disability. So just to put that into context, and I'll use big numbers. Like, so if a veteran is 100% disabled, they're going to receive $4,000 a month. And let's say they're leaving active duty broken, injured, and they follow something great, just beautiful visual marketed Facebook. Hey, we can do everything in the world for you. And they get involved in that. They're going to have to pay them $12,000 when it is absolutely unnecessary. There are pockets throughout the United States that there are some missing services. And there has been proposed bills to help plus up those services with money going to states and those states getting trained individuals down to reach them. But this, having this especially in the state of Wisconsin and state of Minnesota, where you have a service officer and their staff have to go through ethics training and continual education to make sure that you understand and you can represent ethically and morally an individual and help with their claim. Because what's the indirect harm of this is backlog. When you are putting bad stuff forward just because you're throwing 30 things at the wall, rather than very, very much looking at doing just a good fact-finding mission and also providing good sound medical information, sound journal articles to support a contention you're putting forward, you're going to have a higher chance of a positive outcome. But if you're doing all that, you're creating and taking resources away on stuff that isn't as strong. And that's what happens. And these individuals within these companies, they cannot see the claims folder. And the claims folder has all of the information and the cliff notes on why the VA is making decisions, and they're just advising, assisting, and signing a contract to receive money. So I just highlighted in here that there's very strong opposition that has been put out from the Disabled American Veterans and their groups, well as the Veterans for Foreign Wars. And I spoke with the American Legion representative for the state of Wisconsin, and they very much oppose it as well. So I just wanted that to be on the radar and kind of educational.
Where's the support for this coming from? Do you know?
You can read, I put it in there, you can read through. Yeah, you can see where those that have signed on for it. And so what, there are pockets again that don't have some support, but there's ways to reach that. And I just think that a better opportunity would be to look at how can the Veterans Administration request assistance to deal with those pockets. The state of Wisconsin is not one of them.
Right.
The state of Minnesota is not one of them. And there's a lot of states that have that representation. And that's the important part, because the better that you do something, the less frustrated those service members can be. And so I just think that that's just a piece that for educational purposes to know that that's some legislation that I think can have and we're already seeing the impact. We're seeing the impact of, hey, can you fix this? Because they go ahead and agree. Then I just say, hey, you don't have to pay them. You don't have to pay them because it's illegal. And then we work forward to help. And sometimes things go forward because an individual, let's say they destroyed their knee in the military. It's very objective. You don't need help. I mean, you just need somebody to fill the forms out right. You don't need to pay anybody. It's really easy. And so it's really taken advantage of some individuals just because there's a beautiful website that exists on the internet. So I'll kind of end with that. I think that there's going to be more to follow on that. And it's not going anywhere yet, but there's obviously individuals, companies see an opportunity and they're trying to pull in.
Supervisor Hagan.
Clarification question on these companies. Is this similar to all the Camp Lejeune commercials that were playing number of years ago? So is that the same type of procedure that those were doing?
Yes and no. So that was not illegal for the Camp Lejeune, with the PACT Act, when that was approved in 2022, that allowed litigation to go forward to the federal government, because you can't sue the federal government. They opened up that opportunity for that litigation, and that's when a lot of those law firms then were requesting people to connect with them to go forward on that lawsuit. Very similar to the 3M ear protection lawsuit. So though that's different because it opened it up. This has not been opened up. It's just not being enforced.
All right, thank you.
Okay.
Thanks for the clarification.
Any additional questions regarding that information? I put both of those in your
Yeah, I know. Thank you.
packets.
That was helpful. Any questions for Greg?
Okay,
Go ahead.
I'll move on. So nothing significant in the 2025 budget to report, and then no changes with the 2026 as presented with the first round. So I'll move the next item. I'll move on to the impact statement as well as the objective activities within the office. I'd already elaborated on the on item number 2, just with what I view as a great effort and that collaboration that can happen to help some, because even though it seems, if you quantify the amount of people sitting at the table and put a dollar amount, it seems like a lot. But if you don't get that done and stabilize that person, the impact of a jail stay even ends up greater, and not having those support services involved. The other thing is we had the opportunity to participate in a birthday party, got some cake over at the Neighbors of Dunn County, and presented a quilt of valor. An incredibly loving spouse or husband just brought it up, like, hey, is there any way anybody can come over and say happy birthday to him? And I'm like, well, how would you like a quilt of valor and a picture? And so then that happened. And neighbors of Dunn County staff did just a wonderful job as well with that. So it meant a lot to him to have that and get that recognition. So it was a nice.
What number birthday was it?
Oh boy, it was north of 90, I think.
Oh,
Yeah, I apologize for not having the.
that's
specific.
okay. That's
Yeah.
okay.
Yeah, it was, and if I mention a name, people would know him. But
right.
it was a good thing. You can do that. Spend a half hour just to thank somebody. It brings back some of their good memories. And as his wife said, he is extremely proud of his service. He had incredible accolades past the military, but that was the sounding board for him. So it was a nice event to participate in. The next item I'll jump into is I provided the 2025 budget using the document CFO provided for, and we're not tracking any type of we don't have invoices out to collect money, so that's why I always use this. Much different than other programs. So it's accurate within a few days if you look at that. So at this point, I don't have anything at all of any concerns. I do, as things go right now, I do anticipate possible carry forward with some donations, but we have seen an uptick in need as of late. So we'll see how that shakes up. But we do have donations available, along with money with the Soldiers and Sailors Relief to be able to help with that. And I don't anticipate any concerns outside of that. One thing to just kind of on an additional caveat is, and I'll have it in my report next month, is my coworker Jessica, I think I reported last month, was one of 10 outside of the VFW, and she's at the training and represented the state of Wisconsin, I'll say, well, because I asked her like, hey, because she had to take a test at the end. She said she got 100% on it. So I think that that's important
she did.
to note because that's a development opportunity that was
Yeah,
no cost to the county. VFW paid, and when I say no time,
right.
trip, per diem, hotel, everything, they covered that. Did not want to miss an opportunity if a staff is interested in kind of expanding their knowledge and you've got somebody that's willing to pay for it outside of time. Want to jump on that for the development and stuff. So I'll end with that. Is there any questions?
So congratulate her for us.
Oh, for sure. Yeah. I just wanted to note that. It's a good way to represent for sure. All right.
Right.
Thank you.
Thank you. Supervisor Bashan.
Looking at the federal government and if we go into a shutdown, if they can't come to agreement, how would that impact our veterans locally?
Number of levels. The way that it could potentially impact is more on a healthcare side, but those important job duties are still going to be carried forward. But when it comes to the processing of payments, that will not stop, just run it very similar in line with Social Security. Those particular things will be moving forward. But as we know, when things get constrained, it will end up with delays. When you have the positions that will not be functioning, and that would come on the disability side or pension, not the existing payments, but the process to receive that will come to a slow crawl.
So
Okay.
you're not anticipating large number of layoffs?
They're doing a reduction in force. I think my last report, I think I identified they scaled it back with the numbers.
Okay.
But they're identifying that there's still being able to treat and process the same amount. So production there. Logically, you'd look at that and believe that capacity goes down, productivity is going to go down. I haven't seen that yet. For us, it's a 5, 6, 8 month assessment because if a decision happens today, you're not going to feel that impact for probably 8 months. And so that's the evaluation part of this that we have to make. But as of right now, don't anticipate there being any issues, but I'm going to be optimistic that there will not be any shutdown. That's just some media attention. But if it does happen, those that are existing services now, that will not pause, but there will be delays for those trying to get services. Does that answer your question? Okay, thank you.
Okay. Anything else for Greg? All right, moving on. Public health.
Sure. Good evening. So you had a couple things in your packet, but not an actual report. So I do apologize for not having something in writing, but just very quickly wanted to go through a verbal report. So we are holding steady-ish with 36 local to the state of Wisconsin. Sorry, didn't mean to give everybody a heart attack there. Cases of measles. So that's good news. There continue to be a lot of local testing going on for folks with rashes. Knock on all the things, we have not had one pop positive here locally. There's a lot of hand, foot, and mouth going around. So a lot of folks that are just rashy. And it is a differential diagnosis. And so they are testing as well. So, yes. Kids. It's good
Kids,
stuff.
okay. All right, got it. You know about this.
You know. Another update that I wanted to provide is that our nurses, we had 2 nurses support our colleagues over in Child Protective Services and provided a in-service on how to install and modify car seats. Many of our APS workers are youngish and may or may not have kiddos of their own. And so each car seat is different, but if you don't know which end is up, it's really hard to figure that out. And so really happy that we could continue that partnership. We also had our first overdose fatality review team meeting. So this was really an overview And it was to set the stage rather for what an actual review would look like. Typically, we would have technical assistance from the Medical College of Wisconsin. Their funding was held up. And so we had I would say little, some others might argue no substantive support. So our amazing public health educator, Lindsay, really looked at previous presentations they had provided, went and spent time with other overdose fatality review teams, and put together a really fantastic overview for over 20 community partners, several within Dunn County, behavioral health, child protective services, and CJCC, as well as our law enforcement partners, Arbor Place partners, Northwest Connect, Milkweed, fire department, and of course the medical examiner, because a lot of that work really does start with the work that her team does. So that was fantastic. And again, a shout out to Lindsay. We did talk to you last time around about an environmental public health tracking grant that we worked collaboratively with the land and water conservation team. We were not awarded that. We were last awarded in 2019, and this year round, they had decided to really prioritize teams that have never been awarded that funding. So just to circle back with you on that. We did have some earned media coverage for West Nile virus. So I was really grateful to our partners over at the Wisconsin Radio Network to pick that up. That was the easiest interview I've ever done. I loved it. So wonderful. And helping folks get out the word on prevention of mosquito bites, and then asked the bonus question on Lyme disease as well. So hopefully folks that are have been out recently with bow opener and then in advance of gun opener will get maybe one or two more hunters to think about a permethrin impregnated clothing. Doesn't smell, ears can't tell. I've been told.
Particularly if it stays this warm.
Yeah. Yeah. Ticks are active anytime it
Sure.
pops up over 45 looking
Yeah.
for lunch. And so you have some of those warm days or even warm couple of hours in late fall. And we do get a lot of Lyme disease in late fall. So that was great. Also had an opportunity to present at the Regional National Environmental Health Association, lovingly called NEHA. Kind of sounds like something a donkey would say, right? So the NEHA, WEHA, right,
Yeah.
Wisconsin, you guys get it, right? Was in La Crosse this year. And I co-presented with the executive director for the Western Wisconsin Public Health Readiness Consortium. So it's the consortia that I chair as a health officer, and she's our executive director. And so just talking about the intersection of environmental health and emergency preparedness. And so it was well attended. It was a fun presentation. And then always loving to support my colleagues in environmental health. We do have new food packages going live for our WIC participants. And so there are a couple changes that are going out there for your awareness. We are having an increase in fruits and vegetables that can be subbed out for juice. So just recognizing that juice does carry a fair amount of sugar. And so if you can sub out for other high nutrient dense vegetables and fruit, we can set up some pretty healthy eating habits very early. There is an increase in fish and availability for not just canned fish, but also bagged fish. So just kind of a change with processing. And then there is an increase in vegetables and fruit for kiddos as young as 6 months. And so that is in line with the American Academy of Pediatrics, recognizing that they don't have to just eat cereal, that they can also eat fruits and veggies earlier. And then something that has been noted by our participants is that there is a decrease for most people in their milk allotment. So cow's milk, obviously, and that's to allow for a variety of different cheese, yogurt, but then also other supplements like tofu. And then for folks with eggs, they can sub that out for, again, other non-meat options like peanut butter, tofu, and dried beans. So we are hearing a lot of good acceptance around the increase in opportunities for fruits and vegetables for our littles, and some disappointment around the milk issue. And then my last little bit, kind of, if there's aren't any other questions, I have one more thing about finance.
Questions for KT, anyone? Go ahead.
Okay, so with finance, super excited to see our 2 mid-year federal pass-through grants with prevention and public health emergency preparedness. Both of those were forecasting a 30 to 40% decrease in award, have come through with a notice of award that is at baseline, same as the 24-25. Shocked, grateful, but shocked. And so I have not seen the contract come through, but that again, both of those grants start. One starts in July 1st, and one starts in October 1st. And so we were kind of holding our breath to see those awards come through, and so they have gone through.
Great.
And then how that impacts financials, you have that one sheeter in front of you. What you'll see is that we continue to project additional PCS is what we call it, but it's public charge for service in our reproductive health clinic, as well as our licensing programs. And so that is really the work that Carrie and her team have done to increase public awareness of the services that we provide. And so that's to the tune of about 50 grand over what was budgeted. So I'm grateful for that. And not big numbers like what DDS sees, but big for me.
50 grand is big.
It's big for me. Right. And then we continue to be really mindful around our staffing. So we did not fill a position, and we've already talked about that with WIC because of some of the forecasted concerns. And so some of that cost is being recouped in indirect costs to WIC, which we typically don't have room for in our normal grant award. And so that is coming back into the department. And again, just being really mindful of our staffing, since that is the bulk of our cost and the one place that we can really control costs. Any questions about what you're seeing? Oh, and right now we're forecasting at about 60 grand to the good. We'll get closer as we get closer.
Right. Any questions on the balance sheet that you saw? All right.
Thank you.
Thanks very much. All right, moving on to the Department of Human Services, Paula. We have it. Oh, you have another document. Okay. Maybe it doesn't like us.
I don't know what's going on, but I'm having a lot of problems again this evening. So I guess I won't share my document, but I will walk you through it. Right. So one of the areas that we are looking at in the department is ways to increase revenue, increase services, as well as expenses. And it came to our attention that we could look at a new program called Community Recovery Services that some counties surrounding us already have, including Eau Claire and Chippewa. And this program really looks at supporting people in the community. And the short term is CRS. Of course, it has to start with a C because all of our stuff in human services start with a C. So we have CSP, CCS, CSG, CRS, right? So this is a new C. It is a Medicaid reimbursed program. It offers services of community living supports, peer supports, and supported employment. And so this program is a good fit for people that either, kind of want a light touch, maybe not as much as the CCS program for recovery, but would like some services, but not the full wraparound team and extensiveness that CCS is or CSP. And so the service can provide those different programs. It is for people in the community, but it also covers people that are in community settings. And so we have people that are in community-based residential facilities, we call that CBRFs, and adult family homes. And those are considered community settings. One of the things the program can do is it doesn't reimburse for room and board. So that's just like a rent, right? But it does reimburse for community living supports. So if the staff there are doing things to help support their living and documented in the notes and they're an approved provider, we can bill for those services. And so that really does help with some of the cost of placements when people are in those. I did do a look at our budget, and right in our budget for 2026, we have put in there about $300,000 for CBRFs and adult family homes. Typically, if the providers are doing the work correctly, the notes, the documentation, and we're able to bill, I would guess that we would probably get about a third of that back. That's not small change. And then we would also then be able to offer other services in the community for those individuals, like the peer supports and the supported employment for those or those that are not in those settings as well.
Sure.
So we would be able to do that. We would recoup some time for a management position. We can gain that back through the process that happens, the big process called WIMCR. So you get it the year after, right, for some of that when it's not a direct bill. But the program itself would take some setting up. It would take some work to be able to train providers. But once people are trained and it's running well, then it would just be a bill just like all the other Medicaid bills that we process on a daily basis throughout our programs. And so that's something that we are looking at wanting to put an application in. It's a pretty easy application to get certified. The work's really on the end of moving forward the program and setting up processes and training and those things. There are some positives with having a couple neighboring counties already doing it because they've trained some of the providers.
Sure.
So, some of them maybe that we would be also using are already trained. And then we would also need to then train ones that aren't trained or aren't to do that. So really wanting to dedicate some time of a manager to do some of those pieces. So it's a new program, so bringing it forward to you to have that conversation of, is this something we want to move forward with? I know it's not an agenda item, it's just part of my report, but just looking for your kind of feedback, if it's something you would like us to proceed, looking in. I think there's some really good ways to be able to bring additional services and cover some costs that we are already paying for out of our mandated services to be able to recoup some of those placement costs or the support area of those placements with that. So it is something that our team is pretty excited about looking into and being able to maybe offset some of that tax levy with that.
Questions for Paula or comments? Dr. Hall.
So maybe these questions are better answered in a different format, but I'm just trying to wrap my head around. I mean, it all sounds great. I'm just trying to understand. This would be in addition to like CCS, and it's different in that, because CCS also does peer support, yes. But it's different in terms of the supported employment and the community living supports.
So CCS also does some community living supports, and they do supportive employment as well.
Okay.
but they have a wraparound team approach where they're meeting on a monthly basis. There's a lot of natural supports and different providers coming together on a regular basis to work on recovery. Some people we have found don't want that extensive a model. They want peer supports, but they don't feel like they need that teaming model, or they don't need, so this is more of a light touch of that, where in CCS that's mandated. In CCS, they will not reimburse for anybody that's in a group home or adult family care or CBRF. So that's one of the real advantages of this, is to be able to recoup some of those costs. And then it also provides that lighter touch if somebody does want some of these services and is on Medicaid and would meet the functional and financial eligibility for that they could have that lighter touch and receive those services. Because we've heard that feedback from many of our participants.
Excellent. Well, and it's great that we have neighboring counties that already do it. That's so helpful. And it sounds like a lot of the skill sets and the personnel that you would need to do this, we already have that.
Yes. Yes.
Largely, right?
It would be an add-on. So what we're looking at is social workers already working with individuals. And so we would utilize those same social workers. So we would not add additional staff other than a portion of the manager's duties to basically run the program, right, do the reporting and work with the providers, that piece of it. But the workers will already be, because most of them are in placements or those things, they already have a worker, working with them. So they, we could bill targeted case management for this and those kinds of things. We can bill mileage, some of those little things that add up. But the biggest part in my looking at it is really that assistance to help pay for those services while you're in placement. And then that lighter touch for those that don't want the big services.
So would we need to
Excellent. Thank you.
shift managerial position?
Yeah, and we've
Or
looked at that
add?
and not add,
Okay.
we're looking at shifting, we lost the FEP grant.
Mhm.
And so we're looking at shifting some of that. And so I put a proposal together to the county manager. We're meeting tomorrow on that and those kinds of things. But
Okay.
just really wanted to make sure that you were aware of, I'm looking at this program and just kind of wanted heads nodding to go, yes, Paula, go in this direction. And I know it's not an itemized agenda item, but, and I can bring it back next month too, because if we do want to put it on there for a formal decision from this body, but as we're moving forward, I just wanted to get a feel from you as well.
Not sure it needs to come back to this committee unless there are significant budgetary considerations that you would like us to look at. I mean, the design and implementation of programs are your decision, not ours.
Right. But I think the budget implication is increased revenue and increased services.
I love increased revenue.
Kind of hoping that.
Revenue are us.
Yeah, so.
Sounds like a good idea to me. Others? Okay,
Yeah.
go ahead.
Yeah, and then I'm not going to go over my report. You had that. That was a lot of fun things in there, right? Lots of media exposure on our programs and those things. So that's all been, that's great stuff. But I will go into the financial. That's
Yeah,
not
please.
quite as fun.
Yeah, I know.
So you will see quite a swing from last month. We were, 400 and I think it was 50 something to the good. And then when Jerry pulled these numbers together for us, we went, ouch. And so there was one error in a formula that was completed on our children's waivers that predicted revenue. And I won't go into the details of it, but we know what created that. And so that's fixed, and we're actually asking for some training from a previous staff that was moved to a different location in the county, and so that we can really make sure that our staff that's doing the children's waiver is trained on the documents that or the reports that they're using, those kinds of things. So hopefully that eliminates that in the future. But what it did is it really overemphasized by about 4 months the revenue. So that's what happened there. So when we look back at that, that's a piece of this. Also, Beata and Jerry and I spent some time looking at some of the projections in the budget after this was done. And there's there was a few double estimations for some of the payroll items. And so Beata and Jerry worked through those, and it brought our numbers down a little bit. So at the end of the day, we were looking at 380, 900 to the negative. Not, it's better than it was, but still out
Yeah,
there.
not great.
But when you really look at, I looked at cost of placements. I spent a lot of time this weekend doing that. I think we had budgeted 1.7 million for placements. We're at about 2 million in cost for placements. So, we just have had a lot of placements this year. And when we get one out, we get another, and that's at a really high level. And so that's really been, we had 200,000 in juvenile justice. We had 218,000 in IMDs. It's just a lot. And we have another really high placement that occurred as well. So
Can I ask you about that on the vouchers this month? There are a number of items, Wisconsin Department of Health Services Institute for Mental Health. That's $159,653 a month. That was just for August.
all of them. added
All,
up.
yes, I'm sorry, all of the
Yes.
items
Yes.
added, it's totals 159. Ouch.
It's, that's a challenge. And I think, some of the conversation that I believe the executive committee and board is talking about fund balances and different ways of looking at our department
Right,
funding because of the placements, and to try to
exactly.
help assist with some of that, and
An
stop
enterprise fund, yep.
yeah, stop the up and downs with it and those kinds of things. I think I really support that. It's a good move, I believe,
I agree.
to help with that. And so, that is one way to help adjust some of that, but it doesn't take the cost away. It's
No,
there,
right.
right? We have it. So, so there's that piece of it.
Dr. Hall.
So I have a question. So for these individuals who are at Mendota or what have you, so they do not have Medicaid? Is that why we're paying for it?
Yes.
Okay. And they don't have, obviously, then other health insurance that is paying
Right.
for it.
They do, if there is some funding, the IMDs will bill that and we get that back once it's repaid to them. So we do receive some revenue at times depending on that. We have to pay the bill and then it may come back if they have that, but it's not paid in full. It's not ever cover the full cost, but.
Right. It's just very interesting because other hospitals don't work that way.
I know,
Right. They
right?
don't bill your county and then.
Actually, some of them are now for mental health placements. Many of them have contracts with us that they say, we'll only take your individual if you pay the difference of those costs. And so they're becoming much more fiscally
Prudent for them.
prudent for them. And I think, piece of it is, they're taking on the mental health population that there's not sufficient funding from Medicaid for that. And so, they're, know that counties we really have no choice. There's not a lot of facilities. We, have to do that. So there's that piece of it. So any questions about the financial. Otherwise, I did have one more thing I forgot about the director
Please go
report.
ahead, unless there are other questions on the finances. All right,
I
go ahead,
forgot to
Paula.
mention, and Greg reminded me of this, that yesterday at the department head meeting, we talked about the legislative committee items and that we would need to have them probably by January. So if we don't have a November or December meeting, we would want to make sure that we're bringing them forward. So I will look at the human services portion and bring
Okay.
that next month to
Okay.
you if that's something you're requesting.
Yeah, I think that's something we should take a look at.
Then I will follow up with my part of that for you.
Okay.
Yeah.
And I assume VSO will do the same. And public health. All right, great.
Yeah. Thank you for letting me bring that back up.
Yeah, absolutely. All right. Anything else before we move on? All right. Item 10A is the vouchers. We note review of the vouchers. The amount this month is $383,608.72. I studied them sort of carefully this month. It's the placement cost just stopped me. I mean, not that I don't know what they are, but yeah. Any clarification needed on the August vouchers? Nothing? All right, I'll need a motion to note review. Mr. Lamb moves. Is there a second? Ms. Brody, seconds. I just give a little finger over here. All right, any further discussion? More discussion? If not, all in favor of noting review of the August DHS vouchers signify by saying aye.
I,
Aye. Any opposed? All right, vouchers are noted. And we have two budget adjustments. How do I have them listed? Human Services comes first. These are expanded grants, additional funding, and a new grant. So the amount that this increases the budget is $12,302. Any clarification needed on this? Any questions? It's the 15th day. Thank you. Dated the 15th day of October. And I assume that will get corrected. Oh, you already did it? Okay, thank you. Thank you. Any additional discussion? If not, I need a motion. Dr. Hall. And a second, Ms. Supervisor Bashan. Any further discussion? If not, all in favor, say aye.
I,
Any opposed? The Human Services Budget Amendment is approved. And the final item is Public Health, again, in the amount of $18,354. That is correctly dated. Does this need some conversation?
I don't know that it does. It is a couple adjustments and then a community foundation grant for our mental health and wellness action team to do some specific outreach around that. So that's what it's looking like. If we do run up against a salary issue, we will decrease hours with those reductions as they are presented.
Okay, that was the part that I thought you needed to explain a little.
So sharing with you that there is a decrease in some of our budgeted amounts, specifically for Title 10. We have talked about that. And as you guys all know, SNAP benefits have gone away. And so the funding that our WIC program received for SNAP education is also gone away.
Right.
And so our WIC team did not hire. And so they're in a really good position to weather that small decrease in funding. And then with Title 10, we'll have to watch that closely.
Okay.
So our reproductive health funding does continue to be tenuous, and we are watching the federal pass-through on that closely. And so again, if there is an impact to where we cannot cover our costs, we will decrease hours.
Okay. I need a motion to approve this budgeted adjustment. Supervisor Hagan, Supervisor Bashan seconds.
I have a question.
Yes, certainly.
So it says dated the 15th of October, 2025.
It's for the board.
Thank you. I was just like, now that we're paying attention to dates, I'm like, wait a minute. Okay, thank you.
Yeah, this is not our date. It is
Okay.
the board's date. All right. Anything else on this? If not, all in favor, say aye.
I,
Any opposed? The public health budget adjustment is approved. And unless we have any announcements or other business?
I will make the announcement. We are
Please.
having flu shots for employees. And we have a couple dates that'll come out in your email for folks to drop by. We are able to bill insurance, and so we'll do that if you're insured. And then also Medicaid and supplemental insurance there as well. So,
So we will, all the committee will see that?
yes.
Excellent. All right, get your flu shots and your COVID shots and without objection, we are adjourned. Thank you all very much. No dumb
Well,
questions.
Yeah, I was just thinking that, yeah.